When a disease spreads through funerals, who can convince people to change how they bury their dead? When an Ebola outbreak hits a community, the immediate medical instinct is to ban traditional burials to stop the spread. But in this essay from 12 June 2026, researchers Olivia Wilkinson and Katherine explain why that approach usually backfires. Ebola is a virus that spreads through acts of care, meaning strict infection control directly collides with how people mourn their loved ones. The piece looks at the friction between global health and local faith, asking how doctors can stop a disease without forcing people to abandon their dead. Written by Olivia Wilkinson and Katherine in Stat News, narrated for Arva. Ebola can be called the disease of compassion. It spreads through acts of care, like tending to a sick loved one and burying those who died of the disease. It is also a disease in which mistrust, misinformation, and fear run rampant, leading to attacks on healthcare facilities and frantic efforts to recover bodies of Ebola victims. Religious and traditional leaders, who oversee burial and funeral rites, are often the most trusted voices in their communities. They need to be engaged immediately as the Ebola outbreak spreads rapidly in the Democratic Republic of the Congo and Uganda. As researchers on faith and global health, we've researched this field for decades and know that failing to engage these key groups in meaningful ways was a grave misstep in previous Ebola outbreaks. The response to Ebola cannot be effective without engaging trusted local leadership. Religious leadership and religious communities are necessary parts of that response. Burial and funeral rites are moments when Ebola spreads rapidly because people can come into contact with bodily fluids from the deceased. One study estimated that 2.58 further infections occur for every unsafely performed burial. Death and rites connected to it are deeply intertwined in the social and spiritual fabric of a community. Without understanding people's complex emotions and social responsibilities regarding illness and death, emergency responses overlook a crucial part of how a disease outbreak ignites and spreads. Burial traditions are particularly relevant in the case of Ebola. As people express their grief, social obligations compel them to help prepare the deceased for burial, including touching and washing the body, as is traditional in the affected countries, visit the deceased's family, and attend funerals. People are willing to ignore public health messages warning about Ebola's risks, as infection is preferable to displeasing ancestors or disobeying God. In Ituri, DRC, people are attacking health facilities because burial traditions were not respected. A poignant example is a coordinated attack by community members on a clinic demanding that a religious leader's body be released for burial. In 2014, as Ebola spread in West Africa, failing to respect religious practices had profound consequences. WHO guidance applied there stated that religious practices should be disregarded in favor of infection control measures, but this was not tenable advice. For instance, a well-regarded Sierra Leonean traditional healer attending to patients with suspected Ebola fell ill and died herself. Subsequently, over 300 people connected to her funeral died of Ebola too. As the epidemic and global fears associated with it spread, WHO worked with different religious groups to revise their guidance, producing a practical protocol for safe and dignified burials, with specifications adapted for Muslim and Christian communities. Current guidance calls for religious representatives and mediators to accompany burial teams to act as a bridge between biomedical and religious worlds. The updated guidance and practice were a game changer for the West African Ebola crisis, demonstrating the vital importance of respectful and adapted burial practices. A study in Sierra Leone found that religious leaders' messages on Ebola led to a, quote, nearly twofold increase in the intention to accept safe alternatives to traditional burials and the intention to wait greater than or equal to 2 days for burial teams. Qualitative research backs up these numbers. Trust is a key factor, as one UN's A staff member in Sierra Leone in 2014 put it, "Because people trust them, when religious leaders started participating in the revised burial practices, people knew they could trust it, and resistance ended. The participation of religious leaders was a game changer." This calls for two main and pressing actions in DRC. 1. NGOs and health authorities implementing Ebola response programs should undertake a rapid religious dynamics analysis, focused specifically on how traditional and religious beliefs influence perceptions of illness and death, practices related to caring for the sick, and funeral and burial rites in the area. Who are key religious players to engage as partners? A guide developed for COVID-19 is relevant for any public health emergency, with questions to orient a rapid religious dynamics analysis. 2. NGOs should engage community and religious leaders at every decision point, as early and immediately as possible. Many religious actors, including faith-based healthcare facilities and faith-based organizations, are already at work in Eastern Congo on direct response and community engagement. Partnerships with religious actors should not be crisis-driven, but established and shored up over the years. That happens too rarely, but it is never too late to build partnerships, as previous Ebola and COVID-19 responses have demonstrated. Guidance materials for activities in such partnerships are available.
For example, Faith in the Time of Ebola, or La Foi en temps d'Ebola, is a guide for Christian religious leaders in the DRC to help them discuss Ebola prevention and burials through Bible studies. Recommendations for the longer term include systems strengthening with faith-based healthcare systems, including religious actors in disease surveillance systems, and looking to include religious actors in planning and coordination mechanisms. For the current crisis, acting to understand and to engage burial practices with a clear religious lens is by far the most pressing. Olivia Wilkinson is Senior Fellow at the Faith and Global Health Initiative, Georgetown University Global Health Institute. Katherine Marshall is Professor of Practice at Georgetown University School of Foreign Service and Senior Fellow at the Berkeley Center for Religion, Peace, and World Affairs.